Excuse me, nurse. The doctor's prescribing me some medicine, and he said that you would explain it to me.
Yes, well, have a seat.
Okay. Thank you.
How are you?
I'm great, thank you.
My name is Alfredo, and I'll be your nurse today, okay?
Okay, Alfredo.
You went to the bathroom, so yes, the doctor did prescribe you medication, and I'm just here to kind of give you some background education on the medication before you
Okay.
actually take it, okay?
Okay.
Here's a handout that I have for you.
Thank you.
It has lots of easy information, very simple, okay?
Okay.
So, the doctor has prescribed to you what's called carbamazepine. That's the generic name, and the trade name is called Tegretol, okay?
Okay.
Any questions so far?
No, I'm good.
So this is an anticonvulsant medication, and the reason why you're taking it is due to having your frequent seizures, which what we call clonic-tonic seizures, because there's 2 stages to a seizure, okay?
Uh-huh.
And this is caused by the nerve cells, which help control our electrical activity in our brain. What's happening is they're releasing too much sodium, and our brain becomes excited because when the brain has sodium, lots of electrical activities going on, which what causes the brain to become excited. And again, the medication works in the body because the medication carbamazepine works by preventing too much sodium to be released by our nerve cells in the brain, which ultimately is going to help reduce, if not eliminate, the seizures by preventing the electrical activity. Because remember, sodium kind of excites the brain.
Oh, uh-huh.
It's going to prevent too much from being released, so hopefully you won't be experiencing these seizures. And again, the outcome of taking this medication is to overall help prevent the seizures due to their anticonvulsive effects on the brain, okay?
Okay.
Any question there?
No, it's kind of complicated, but I get it. Thank you.
Okay, perfect. Okay, now how was the medication prescribed? Again, I don't know which form the doctor's gonna want to prescribe, but I have a couple listed here and some information you should know. So, the medication is typically prescribed either as a sustained release pill, a tablet that can be chewed or swallowed, and then an oral suspension, which is kind of like a liquid, okay? Like liquid form. Now, what are the guidelines for each type of administration? So for all the routes, you know, it's best practice to go ahead and have it with the meal to prevent any stomach upset, anything like that. And then as you can see here, the sustained release form, you only want to swallow the pill whole with water. You don't want to crush it, chew it, none of that. Because if you do that, what's going to happen is going to reduce the absorption rate and reduce the effect. So it may not be as effective if you chew it or swallow it if it's a sustained release.
Okay.
Chewable tablets, again, these ones are okay to chew and crush. Take it with water. Oral suspension, which is the liquid, you should not mix it with any other oral drug suspensions, which is the liquids. And then, big one right here, do not take the medication with grapefruit juice. And the reason why is because it can go ahead and increase the effects of the medication, which can cause you to experience those adverse effects, which we will get to in a second, okay?
Oh, okay.
So that's a big emphasis. No grapefruit juice, none of that.
Okay.
Not even eat it, okay? And then you want to take as much of the daily dose at bedtime. And the reason why is because this helps prevent you from experiencing those side effects during the daytime.
Gotcha.
Because again, if you're taking it during the nighttime, you're sleeping through the side effects, so it would be better for you to take it at night, okay? Now, side effects. So we have a couple that you should be aware of. Visual disturbances, headache, lack of coordination, which could be like your balance or your walking. Skin rash, which can become serious. Sensitivity to sunlight. Decrease in blood cell productions, which means your red and white blood cells. Painful red blisters and lesions of skin and the mouth. And this is what we call Stevens-Johnson syndrome. This is a medical emergency. So if you experience these lesions, like sores in the mouth, or like kind of like an open like pimple, as I can describe it, definitely go ahead, call the office, come to the emergency room. It's a medical emergency. Interventions that you can do is to protect yourself from the sun, because it can cause you to be sensitive. So you want to make sure you're wearing hat, long sleeve, wearing sunscreen to help decrease those effects, okay? Help you prevent sensitivity and burns. And then you also want to go ahead and not drive or do any other activities if a lack of coordination occurs. You want to prioritize your safety first. So I always encourage my clients to go ahead and wait until we see what the side effects are before we do more, I guess, hazardous activities of daily living. And then what should I report to the provider? Fever, sore throat. The reason why is because these can be signs of infection due to it decreasing the blood cell production. Easy bruising, and again a rash, because it could be serious and become a medical emergency. And down here are just my references, okay? Very reputable sources. You can go ahead and look at the Davis Drug Guide for more information. And the drug takes at least a month to kick in.
So I have to take this pill or whatever for a whole month before I start feeling better?
Yes, a whole month. You know, hopefully, you know, seizures don't happen within a month, but yes, it would be a whole month for the drug to take effect, okay?
Okay, all right.
So if you don't feel anything, don't stop taking it, keep taking it, because it takes a whole month, okay?
Okay.
Alrighty, any questions for me?
No, I guess I'll just have to wait and see if the doctor's gonna give me syrup or a pill or what I'm gonna do.
Yes, and good thing you have this handout now, okay?
I do. Thank you so much. I
Thank you.
appreciate it.
Have a good
Very
day.
informative.